Hi, so I just wanted to do a quick video because I haven't been on done a video for a while, but that's because I've been just kind of living life. Everything's been okay. You probably know a bit about my story from previous videos. I came off antidepressants too quickly, went into protracted withdrawal, and decided to reinstate and then come off again in the future when I'm ready, but this time more slower, carefully, and using the most recent evidence-based guidelines. So this is just really a video of hope and reassurance out there, because I'm okay. It was a learning curve for me, that obviously we're learning a lot more now that antidepressants, you know, you need to be very careful. You need to come off them properly, carefully, slowly, especially if you've been on them a long time, and you need to do it under medical supervision. So we know that now, and that's not something that I certainly wasn't aware of from my nurse training many years ago. So it's something that we're learning, so that's good. But there is hope out there for people, and that's kind of the message I wanted to give, because I know this is quite a contentious topic, and what I'm going to touch on now, but I think it's really important, because there's a lot of things that I've said in previous videos that I would do differently. And although I found a lot of the community in psychiatric withdrawal, so we'll call it the harmed community, so people who have had withdrawal, or for example people who've had adverse reactions to psychiatric medication, so I found it validating. That was one of the positives that I found, that I realized that actually, you know, what I was going through, I wasn't on my own, it was recognized. So that was really helpful. But then on the other side, and I think this is where this might make me slightly unpopular, but actually I don't really care, because I think it's really important for people. Because when I entered into the withdrawal community, as well as finding some of the things that I read very helpful and validating, there was also a lot of things that I read which caused me a lot of fear, whether it was you know, unintentional. People were very frightened, and you've got to remember that the people in a lot of the forums and the harmed community, you know, they're often frightened themselves. There was a lot of conflicting advice, lots of things on things you shouldn't eat, things you should and shouldn't take. One person would say one thing, one person would say another thing. And I've had a lot of time over the past few weeks that I've not been on YouTube or anything to reflect, and actually that for me personally wasn't very helpful, because, you know, what you've got to remember is, obviously when you're on an antidepressant or a benzodiazepine, they will be helping for some people some anxiety, not in all cases, but you know, for me, I guess you know, I want to come off the medications because that's right for me. And again, that's not what I'm suggesting for everybody. That is a medical decision between you and your prescriber. But once that medication was stripped away, obviously there was no kind of barrier or anything that I'd put in place to protect me against that kind of anxiety that I think we all have in life anyway. That's very normal. So when I went on these forums and was reading, you know, all these things about, you know, the word kindling, akathisia would come up. And again, I'm not disputing that they're not real, but I think they're the worst case scenario. And because I didn't have any medication barrier of protection, that's a fear response. So, you know, yes, that might be withdrawal, and I'm not taking away anyone's withdrawal experience, but I honestly believe it's more nuanced, if that's the word. There's lots of factors, you know, the anxiety created whilst in the community, perhaps the anxieties that were coming back that perhaps somebody was put on the medication for, And so it's just to be really mindful of that, you know, and it's not to take away, because, you know, a lot of the forums are very, you know, very helpful. You meet some very supportive people, they validate your experience. But, you know, for me, if you come away and you feel worse, then that's telling you something. So it's just something to bear in mind. And that's one thing for me that I'd perhaps do differently, because the withdrawal for me was really difficult. I had to reinstate. That was my decision with my prescriber. And again, I'm not saying that's for everybody, but it was okay for me. Nothing, you know, it worked out, and I'm through it, and I'm okay. Yes, I'm still on antidepressants, and yes, my plan is I want to come off them. That's my decision. I'd never advocate anyone to do that, because everybody's different. But I do a lot of things differently. And, you know, I know now that you can't come off them within weeks, which, you know, a huge part of me feels really stupid. You know, I should have known that as a nurse. But actually, there wasn't a lot when I did it a couple of years ago now. You know, it was still kind of, I think it was still kind of, this was sort of starting to come out, and now it's, you know, it's really out there. So it's just something to bear in mind that, you know, I know many people who've come through it, and, you know, and if that is a choice you want, and again, it's not for everybody. I've always sat right in the middle of, you know, I absolutely recognise antidepressant withdrawal. I've been through it. I absolutely recognise adverse side effects from antidepressants because I've been through it. And those things absolutely need speaking out about loud and clear. And, you know, I think prescribers should be having these conversations. They shouldn't just be on the box of a prescription. You know, but that, again, doesn't make me anti-medication in any way, because it's a personal choice. And for some people, you know, they may not have any problems, they may not have any adverse side effects, and they might find it helpful. So that's kind of where I sit. But a big part of what I wanted to do from my experience is, you know, raise that awareness that antidepressant withdrawal, you know, really is a thing. It's a drug at the end of the day. I don't think we can step away from that. You know, it's a prescribed drug, but it is a drug, and it does affect people's. So to me, you know, of course, it's going to have effects, you know, most likely when coming off, which is why people have to be careful, and you know, people have to have that knowledge. And, you know, we're also knowing as well, especially with the recent things, you know, in the press about people who've come to harm when starting on antidepressants. That's really, you know, a critical time. You know, that you know, family members should be aware that when somebody first starts on an antidepressant, you know, they may or may not have the stomach, excuse me, an adverse side effect, and in the worst case that can be suicidal thoughts, and that needs speaking out about. That's not about being anti-medication, that's about being factual. But I haven't been on for a while, but I just wanted to touch base, and again, just, you know, do what's right for you. But I just wanted to really lay that point, which I know is an unpopular point, but sometimes it's just getting that balance of what you do find helpful and unhelpful in forums. And, you know, you don't know who is giving you that advice. You don't know their story, you don't know their situation, you don't know their qualifications. And then if somebody says something different, that is going to lead to a lot of angst and anxiety. So it's just being really mindful of that. But I wish you all well, whatever path you choose is the right one for you. I would never advocate for somebody to come off their medication, because I know some people find them helpful. It's so individual, but I just think you know, this kind of fear out there is it's just not helpful. And I just want to give you hope, because I've been there. I've been, you know, I went through withdrawal, which was really quite challenging, to say the least. I won't go into that, but I've also found myself, you know, in forums amongst, you know, people I didn't know, and you know, some of the kind of things I read were I can't put it any other way, were quite unhealthy, really. And it's just, you know, being really mindful and having your eyes open with that, and just looking after yourself. Okay, cheers, bye.